Anand Eye Hospital presents Binanual Capsulorrhexis, taming the horse without bridle. We do not have any financial interests. The concept: cystiotome or the Capsulorrhexis forceps from one side port and viscoelastic cannula from other side port. The basic science behind is to maintain a positive tamponade all throughout in the interior chamber to counteract the positive intralenticular pressure, and it also stabilizes the globe during surgery under topical anesthesia. The milky fluid can also be washed out easily. As we see here in this video, this is a white cataract. We make a side port entry. We make two side port entries, one at the 12 o'clock, the other at the 6 o'clock. Note is made that this is under topical anesthesia. This is the viscoelastic cannula and this is the cystiotome. From one side port we will use the visco cannula, and from the other side port we would introduce the rhexis forceps. So trypan blue is used to stain the white capsule. Viscoelastic is gently injected to drain away the trypan blue, and then we introduce the cystiotome from the side ports and the viscoelastic cannula, as you can see here, from the other side port. Note is made that under topical anesthesia the globe is stabilized. All throughout a positive pressure is maintained. The visco is being gently injected all throughout the procedure. As you can see here, the air bubbles which move continuously, showing that the visco is being injected, which drains out through the other side port. We are maintaining a positive pressure, and see how beautifully a 5mm round regular Capsulorrhexis, despite this being a white cataract with high intralenticular pressure, can be made. Note here is made that if we slip off, again viscoelastic can be injected and the rhexis can be completed safely. Another case you can see here, it's a bag filled with white milky fluid. So side port with viscoelastic. The moment the nick is made, the white fluid, the milk comes out. See here, the viscoelastic is used to wash away the milky fluid so that easy access is made to the visibility. A positive tamponade is being created and the flap can then be moved easily. We can exchange this by using a micro Capsulorrhexis forceps. Even if the patient squeezes, the globe can be stabilized. So this Capsulorrhexis forceps can then hold and the rhexis can be completed within a single go. Another cataract, white cataract, viscoelastic inside, rhexis forceps, and this micro rhexis forceps holds the flap which has been created using a cystiotome, and see how beautifully this rhexis can be made. Circular 4mm rhexis. Note is made that viscoelastic is being continuously being injected to maintain a positive pressure. The last tag can be easily removed, which is very difficult, otherwise it would extend. So a continuous rhexis. Another case, white cataract with high intralenticular pressure, micro rhexis forceps, and viscoelastic is being injected through the side port. And a beautiful round regular rhexis. Another white cataract, high intralenticular pressure. A nick is made with a cystiotome. Note is made the viscoelastic is being injected. The flap can be lifted easily. A micro rhexis forceps can then be used to complete the rhexis in a circular fashion. Continuous viscoelastic maintains a positive tamponade, prevents the runaway of the rhexis, prevents the Australian flag sign, and helps in achieving a round regular rhexis. It also prevents the shallowing of the interior chamber. It prevents the eye from moving, so stabilizing the globe when making a rhexis in topical anesthesia. Note is made of how the high intralenticular pressure and the fluid impedes the visibility, but continuous putting in of the viscoelastic helps in maintaining the convexity, the flattening of the anterior capsule instead of being convex. So this is held with a microrhexis forceps, and the rhexis can then be gently completed. See the white milky cataract, continuous viscoelastic through the side port, maintaining a positive tamponade, and the rhexis can beautifully be completed. So this technology, this innovative technology that we have introduced, maintaining a positive pressure from the side port, helps in achieving rhexis in near total cases despite there being a high intralenticular pressure. Another white cataract, capsule has been stained with trypan blue, a nick is being made. So continuous viscoelastic is being injected, which can be noticed by the movement of the air bubble. The rhexis forceps is used to hold. And the capsule can be pulled easily, and this positive tamponade helps in completing the rhexis. So a group of 150 cases, including 80 males and 70 females, were subjected. This group included patients between 40 years to 70 years, with predominantly they were the senile cataracts. Out of the 150 cases, in 128 cases, adequate sized continuous rhexis were achieved. In 20 cases, rhexis achieved was small sized, which was subsequently increased after the IOL insertion. As you can see here, this is the continuous curvilinear capsular rhexis. Extension usually occurs with positive intralenticular pressures. So in two eyes, rhexis was torn and extended because of the extreme squeezing of eye in one patient and high intralenticular pressure. The take-home message: bimanual rhexis is an excellent, less time-consuming method of performing a successful capsular rhexis in hypermature cataracts. Thank you.